I'm Sarah Halter. I'm the executive director of the Indiana Medical History Museum. I know many of you already, and it's great to see you all here. Thank you for coming. We're here today to honor the memory and celebrate the work of Dr. George H. Rawls, a man who truly was a pioneer for Black surgeons in the Indianapolis community and who spent his entire career and retirement advancing minority representation in the medical field. Dr. Rawls graduated valedictorian from Florida A&M University, where he earned his Bachelor of Science in Biology. He then attended Howard University Medical School, where he earned his medical degree with Alpha Omega Alpha honors. He served in the U.S. Army for 2 years and completed his surgical residency at Ohio State University and a surgical internship at Philadelphia General Hospital. In 1959, Dr. Rawls began his practice as a surgeon in Indianapolis, and after a distinguished 34-year career, he was appointed Assistant Dean of Student Affairs and Clinical Professor of Surgery at IU School of Medicine. Dr. Rawls helped launch the Master of Science in Medical Science program in 1995 to support students from underrepresented populations in medicine. As of 2020, the MS Pipeline program had graduated 469 students, with over 300 matriculating into medical school. In 2001, Indiana University awarded Dr. Rawls an honorary Doctor of Science degree to recognize his enduring efforts to increase representation of minorities in medical professions. A devoted student of history, Dr. Rawls' most important contribution from our perspective was perhaps his History of the Black Physician in Indianapolis, 1870 to 2000. Dr. Rawls passed away in 2020, and later that year, the Indiana Medical History Museum established this annual lecture series to honor his memory and recognize his many important accomplishments, as well as to tell the story of medicine as it relates to minorities and underrepresented and underserved groups whose stories and voices are frequently left out of histories and of the historical record. Our goal for this series is to highlight the vast and varied ways that minorities have, willingly or not, both participated in and experienced medicine. These rich and important stories have been too often overlooked or ignored, missing great triumphs of invention and discovery, as well as heartbreaking incidents of racism. And now I will introduce our speaker. Norma Erickson really needs no introduction. Would you like to come out of your cubby hole? Norma Erickson is a graduate of IUPUI with bachelor degrees in religious studies and general studies with a concentration in math and science and a Master of Arts in U.S. history. Her thesis focused on African-American healthcare in Indianapolis at the turn of the 20th century. Previously, she worked as an analyst in clinical, forensic, criminal justice, and athletic drug testing laboratories. As a museum volunteer, she began giving tours of the old pathology building in 2004 and served as the IMHM education manager until early this year. Currently, she is satisfying a long-held desire to work at the Indianapolis Motor Speedway Museum, where she is a STEAM education facilitator in the Innovation Workshop. She's the author of The Lincoln Hospital of Indianapolis, an effort to remedy a lamentable condition from traces of Indiana and Midwestern history, and Extending Helpfulness, Carl G. Fisher's Philanthropy to African Americans, also from Traces. Please join me in welcoming Norma Erickson. I'm very glad to have you back.
Thank you. Thank you. And it is good to be back. And thank you all that are here and watching at home. It's a nice day outside. The Colts are on TV right now, I think, at this moment. There's a race at the Speedway this weekend, yet here you are. So thank you very much. This talk really grew out of one thing that I wanted people to know about. And so I have to build something around that. This is a very general talk for the general public. It doesn't go into great depth in chemistry and medicine, but at least I hope you'll have, those who don't have an understanding of the situations that sickle cell it manifests in, that you'll have some idea about that. So I'm also Indiana centrist. When I do history, it's about Indiana pretty much. So that's why I picked this topic and pursued some things that we've seen. Okay. One of these makes it go, but none of them that I press. Thank you. So the questions to start off with, what is sickle cell disease? Why is it a topic for the George M. Rawls Memorial Lecture? Sickle cell disease is a genetic inherited condition that results in the production of an atypical hemoglobin. And in the United States, sickle cell disease is most prevalent in the African American population. About 1 in 13 Black babies are born with sickle cell trait, meaning they've inherited a gene from one parent. And about 1 in every 365 Black babies are born with sickle cell disease, meaning they inherited 2 copies of the sickle cell gene from their parents. So nearly 300,000 children are born with sickle cell disease every year. This information is from the National Institutes of Health, the National Heart, Lung, and Blood Institute division of that organization. But this genetic disease causes anemia, jaundice, and severe pain. It causes blocked oxygen flow in the tiny vessels of the lungs and other parts of the body. Hemoglobin, since that's what the issue is, a complex protein. It has an iron molecule 4 actually in them, and that's what carries oxygen through the blood to the tissues. And red blood cells themselves are biconcave discs, which always makes me think of a long donut, but with no hole, just a squish in the middle. So it's a wonderful shape. It's smooth. It'll go through blood vessels. And also because of that indentation on both sides, increased surface area, so transfer can take place. There are different variants of hemoglobin. Before you're born, your hemoglobin is hemoglobin F, fetal hemoglobin. It's much better at transferring oxygen from mother to baby. And you have that until after you're born. And then slowly or quickly, you start changing over to hemoglobin A, which is adult hemoglobin. And that could take a little months, but you eventually end up with hemoglobin A. Hemoglobin S is the variant that we're talking about that causes problems with sickle cell disease. Just one of the nucleic acids in the gene is substituted, and it causes this aberrant hemoglobin to be made by the body. So this is what happens. That nice concave disc that can flow through the bloodstream, will become sickle-shaped. As a molecule of hemoglobin drops off its oxygen and goes on its way, everything's fine. When sickle, one with the hemoglobin S in it, arrives and oxygen tension is low, it curls up and quits and blocks everything, the little blood vessels and things like that. So that's generally what's going on in sickle cell disease. Sickle cell disease did not spring forth in 1904 when the first doctor saw it in the United States in Chicago. The mutation may have emerged around 7,000 or 5,000 years ago. There's different researchers who are trying to trace back through analyzing mummies, bones, things like that to try to determine when this disease really did emerge. But at least in the US, he published it in 1910, James Herrick of Chicago, but I think he actually ran into this patient that came to him in 1904. The patient was from Grenada, so that's the Caribbean area, which he was from a well-to-do family. He was Black, but he came to Chicago for dental school. So the Herrick, who actually wasn't the first one to say it, the guy with the first eyes was the intern, AKA lab technician, who first saw it, said, hey, so Herrick is the author, but he is credited. So this is what was described: large, thin, elongated, sickle-shaped, and crescent-shaped forms. And then between 1910 and 1927, there were really only 13 more cases that were published. Certainly it was going on, but that's what was published. Now, the first publication in 1910 is another significant year. Any takers? The Flexner Report on Medical Education in the United States, which ultimately closed all but 2 Black medical schools in the whole country. So from that point on, you had fewer and fewer Black physicians being trained. And of course, those are the people who would have seen these cases and known about it more than the white doctor taking care of Black people. And that all depends upon where you live. And that's a whole nother lecture, okay? So in 1922, then one of the reporters of these extra cases named it sickle cell anemia for little sickle cells. And then Hayden and Schuck said that there were other kinds of it, like sometimes people had it, sometimes they didn't have it. They called it sickle cell trait. The 14th case then was reported by doctors E. Vernon Hahn and Elizabeth Bierman Gillespie at the IU School of Medicine in 1927. Did you put a picture of him there?
Yes.
Okay, yeah, that's Dr. Hahn. Okay, so I'm glad because this is all I found. And E stood for Ezra. I looked that up. Born in Indiana, here's Indiana all over. Born in Indianapolis, attended Shortridge, graduated from Wabash College, taught for a while, taught chemistry at Shortridge, and then ultimately earned a medical degree from IU School of Medicine with the highest honor in 1920. He became a neurosurgeon and a psychiatrist. And he'll show up in various places when you look him up. One of the unlikely places, well, not unlikely, actually, when you think about it, in Wilbur Shaw, when he crashed in the 500 in 1941, Hahn was his doctor and put him back together. Maybe that's why I like Vernon Hahn so much. Elizabeth Bierman, Dr. Betty, was born in Colorado, but she grew up in Bloomington. Her father was a professor there. She went to IU, got her undergrad degree, and then also went to IU School of Medicine. Her internship at Robert Long and also Riley, and was awarded cum laude from her work on the sickle cell. And then she moved to Cincinnati. So here's the report. This is actually from, it's a snip from the journal that they reported in, the Archives of Internal Medicine. History, Curtis C. Colored, age 4, was brought to Riley Hospital December 23rd, 1925. And he had attacks of epistaxis, which is nosebleed, and pain, vomiting, very bad shape. His health had never been good. The list is amazing. He had bronchopneumonia at the age of 8 months, rheumatism with swelling of the elbows some months later, pertussis at age 1, measles, flu, influenza at age 3. His mother was not in good health. Father and 3 sisters were. So this is kind of a snapshot too of what you might see in that decade. Maybe not in all families, but certainly it was in theirs. So building on what had already been learned from these other doctors of what they thought was going on with sickle cell, some thought that the cells were produced that way by the body in these particular people. But it only caused them problems at certain times. There were just a lot of unknowing because they didn't have the technology. You got to have technology to see the things that they were trying to prove. So this is a sketch from that same article of what they did. So it's a microscope and a well for the blood sample to be in, and then a gas chamber that goes by it. And I so much want to say they passed gas, but I won't. They moved gas through the tubes, so it made it so they had more nitrogen in it, and I forget what else they used. But whatever happened, when there was not very much oxygen, the cells sickled right in front of their eyes. And if they restored the proper ratio, the cells actually went back to their former shape, which nobody had seen that before. So that was the to me, the biggest thing that came from that. In the paper, they concluded that sickling occurred in the environment, not of the RBC, not in a malformation. Latent sickle cell disease was not. There was something else going on familiarly. People still thought, yeah, it was inherited disease, but they weren't sure how it happened. And then he also suggested the term trypanocyte for the name of the sickle cell. So, and also drepanocytemia and drepanocytic anemia, which sickle cell is easier to say. I don't think it ever caught on. I have heard of a drepanocyte though. So that was what they, that's what they came up with. And if nothing else really happened from that, to me, one of the biggest things was just knowing that about the oxygen level, that when a person got overworked or whatever situation, high altitude, different conditions, the cells were going to do that because that was their problem. So that made it, and they didn't invent this, I'm pretty sure, and I can't find who did, but it made it easy to test for it. This picture, I'm pretty sure you cannot see, but this is sodium metabisulfite, which if you mix that with a blood sample, it will reduce the oxygen in the cell, and then they can actually see that sickling happening under the microscope without passing gas. This is from upstairs. And if you, and you can't read it. It actually has in handwriting for sickle cell anemia written in. Oh, you can read it. I guess if I looked at it like that. Yeah, so that's. So it really wasn't until 1949 that the variants were developed, were characterized, and that took technology again. Hemoglobin electrophoresis had to be invented by him, and hemoglobin variants were better defined. They could actually tell a difference between a person with 2 sickle cells, hemoglobin S, and then S and A. And S and A would be a person who has trait. Many people with sickle cell trait only got that one copy, live perfectly normal lives, and they're fine. But they do still have a little bit of hemoglobin S many times. And as long as their hemoglobin S is below 35%, roughly, of what their total hemoglobins are, they'll be okay. But if genetically they do have a more greater percentage, they can have issues at times of great stress. Then in 1954, Anthony Clifford Allison noted that persons, this was him working in Africa, with sickle cell trait, not the disease, the trait, resisted malaria. So this mutation happened in an area of Africa. And of course, then it got here by the transatlantic slave trade. But this is what the Sahara Desert looks like now. But 14,000 to 5,000 years ago, it was lush with trees and lakes and mosquitoes. So the mutation developed in people. Somebody had an aberrant, whoop, got an S, I got valine there instead of glutamine, and didn't get malaria, or at least didn't get it badly. So because they lived, they passed it on. So that's how it comes down to us. That's a nice picture. But we know something here about malaria at the Indiana Medical History Museum, because malaria was key to treating patients with end-stage syphilis here from 1925 until the mid 1940s. So I was looking at some of the annual reports of what this department in the pathology department was doing, and of course, we need to go back to 1917 when Wagner von Jauregg published that fever was a treatment for syphilis. He tried different ways of causing someone to get a fever, and including typhoid fever and things like that. But the best thing that worked was giving a person malaria. He had another patient come into the hospital, had malaria, and went, you got fever, and I can treat his fever. Let's give you, syphilitic person, a fever, and we will treat the malaria. But we'll worry about that later. Yeah, so it worked. So in 1925, Dr. Walter Bruch was hired in 24, And he initiated the malarial treatment here at Central State Hospital for the insane, which is what it was called in 1925. Broich noted in 1927 that 15 years before, Barr had noted in one study of 206 cases that there were 5 people there who had had typhoid fever during the course of the study that were greatly improved, but made no scientific significance attached to the fact that the fever had done anything with the syphilis. So now it's like, oh, 1927 was an important year also because the guy back in Vienna, Dr. Wagner Jauregg, won the Nobel Prize for physiology and medicine for his malarial treatment of syphilis. So it wasn't a snake oil thing. It was considered completely scientific, and 30% was what the recovery rate was. 30% of his patients got better, but without that, it would have been 0% because they were going to be dead in 1 to 4 years is pretty much what was going to happen. So. In the 1941 annual report, we see a mention that the Black patients did not get malaria. When they tried to inoculate them with the malaria, the live parasite, they didn't get it. So what was up with that? So they worked with the VA hospital in Tuskegee and received a sample of quatrain malaria, which is a little different. It's passed on by a different kind of parasite. It's malariae instead of Plasmodium vivax or falciparum. And so he treated Black patients here in 19 immune patients, what they called immune patients. There were some white people who didn't get it either if they were inoculated with the malaria. But he didn't give me the answer. He didn't say how many of them got better or anything. It's at least not in that report. Maybe one exists somewhere. So that was the experience here at Central State Hospital. This was, Dr. Barr mentioned that St. Elizabeth's in Washington was the first to use the malaria treatment, but they stopped using it very soon, various reasons, and that this hospital had the longest experience and kept it going for the longest time than anybody else in the country. The strain of malaria they had at first got contaminated. They had to bring in another one. And where do you get a strain of malaria? From somebody who's been where there's malaria, and you use their blood and pass it through from person to person for 20 years. I'm just thinking, is there anything more I need to add to that?
Stuff you could add.
I'm sure. Yeah, but if that gets the job done, because I moved on to the 60s and the 70s now. There is more awareness of sickle cell disease and sickle cell trait in the news, people, and also the effort of different activist groups that the Black community was not getting the medical attention that they needed, and that they didn't have the research that should happen in order to fight this. And for those of us who remember Black Panthers, they were a scary militaristic group. They were actually the Black Panther Defense League to defend their Black community. They were also very much health advocates too, and started free clinics around the country to test people for sickle cell disease. And I have not found out what the Black Panther chapter did here in Indianapolis, so I apologize for that. But then also, at about the same time, the 1972 National Sickle Cell Control Act was passed. This was a federal law that called for more attention and research in that area. And also newborn screening started around the same time. There was a way to collect blood at birth and be able to test a child and know right away if they had hemoglobin S. So that was, oh, and there were laws passed in Indiana that year too. There was one law, HB 53, House Bill 53, not 1253, that said that physicians could make a couple who was getting married take a sickle cell test if they thought that it needed to be tested. The other law was first graders were going to be tested if a doctor thought that the first grader needed to be tested for sickle cell. This was something that was introduced into the legislature House. This is Indiana laws in 1972 by Ray Crow. That Ray Crow, the guy who led the 1955 Crispus Attucks team to the first Black winner of the high school basketball tournament. He became a politician later on after that. Another guy from Chicago co-sponsored the bill. So that is what they did. But there were opponents to that. And one man wrote a letter to the editor because he said, you're placing sickle cell disease right next to venereal disease, because at that time, before you got married, you had to take a syphilis test in order to get your marriage license. And he was upset that this disease, which is not a venereal disease, was being conflated with that. So he was saying that's what he was all for the kids being tested. But that was, I thought, an interesting thing. This right now is actually from the Indiana State website, the health website. These are some of the things that are screened for in newborns in Indiana. And you see the hemoglobinopathies that are there that are mentioned, and the FC. There's also SC too. There's C's. There's like 5 different alphabet soup for hemoglobin that could go wrong. So they do that. And many other things too, like 80 or more tests. Inborn errors of metabolism, they're called, that are tested for, that can help early on treat or make a patient, parents aware of what's going on with their child. And that is done still, I guess, at IU School of Medicine. They have their newborn screening lab there still, done for the whole state. Yeah. Oh, I'm not ready for that yet. Go back. Another thing in the 1970s, I should have said this around the same time as the other things that happened in 72, there was a sickle cell center that was started here in Indianapolis. It was at Riley Hospital, and it was for the purpose of treating sickle cell patients and also doing some research. And Dr. Edward Hicks, who was a Black biochemist who worked at IU School of Medicine, was in charge of the labs. And then, of course, the other physicians at Riley, like Dr. Wheatman, were part of that. And then also this became affiliated with Martin University, Martin Center, to help the Black community with their issues with sickle cell disease. I really have nothing more to add on this, except I think it would be good if you visited this website and learned about this doctor, Dr. Jacob. I've not met her, never talked to her, but when I read about the program, I think it's something people should know about. She runs the Comprehensive Pediatric Sickle Cell Disease and Hemoglobinopathy program at Riley. NIH funded. So you might look into her.